So let's talk about asbestos and related lung issues. So asbestos, basically it was a material like a plastic, different composition. It was used for 50 years in UK, everywhere in pipes, boilers, tiles, railway construction, shipyard, insulation. So in MCQs, we will be seeing someone who is elderly was working in any of these areas, now coming in with some lung issues. So we need to know. And also all the asbestos related issues and exposure are for occupational compensation in UK. So this is the crude diagram: lungs, chest cavity, parietal pleura, visceral pleura, and pleural space. So we will see how asbestos will affect each one of these. So let's talk about lungs. Asbestos can cause lung carcinoma, especially bronchogenic carcinoma. So it will mostly settle in the upper area where the bronchopulmonary structures are. It can cause asbestosis, which is mainly the lower part of the lung will be fibrosed. Talking about the pleura, it can be pleural plaques, it can be diffuse pleural thickening, it can be cancer of pleura, which is mesothelioma. So let's talk about all these issues separately. Pleural issues. There are three pleural issues: pleural plaques, pleural thickening, mesothelioma. Pleural plaque, basically along the pleural line, there will be some calcified plaques, as we can see here. We can appreciate these whitish plaques. So they are basically asymptomatic. They usually take 20 to 40 years after asbestos exposure. We don't need to do anything. No follow-up is required. Pleural thickening is basically this whole pleura, mostly the parietal pleura, which is covering the chest cavity wall. It will be thickened more than 3 millimeter of thickening, mostly parietal pleura, as we discussed. Shortness of breath and chest pain. Spirometry will be restrictive because lungs are fine. There is no obstruction to exhale, but there is some pressure outside. So spirometry will be restrictive. Person will be able to exhale quickly. And investigation, we need to do X-ray and CT. And if we talk about the management, we usually don't need to do any specific management. Mesothelioma, we know the cancer of the pleura of the lungs. So cancer of pleura, malignant disease, shortness of breath, chest pain, pleural effusion. Now, one thing about pleural effusion, because of mesothelioma, if we drain that pleural effusion, it will seed the cancer through that tract. So if we know someone has got the history of asbestos exposure coming in with all these symptoms with weight loss and we are thinking of mesothelioma, we we don't need to directly drain pleural effusion. We need some specialist advice. Investigation, because it is a cancer, we do all the scan. It is a malignant disease. We need to do PET scan, obviously full body CT, MRI, chest X-ray. Management is palliative chemotherapy because it is malignant. We can't do anything. So talking about the space now, we have talked about pleural issues, space-related issue, pleural effusion, asbestos sometimes cannot cause any harm to lung or pleural surface, the pleura, but it can cause some harm to the space. Some fluid buildup, which is mostly exudative, but asymptomatic, we don't need to do anything. Lung related issues, let's first talk about lung cancer. Bronchogenic carcinoma is most common, can be caused by this. Asbestos can increase lung cancer risk by 5-fold, and cigarette can cause lung cancer risk by 50-fold. So if someone is exposed to asbestos and is also smoking, their chance of getting lung cancer is 50 times. The last one is asbestosis. Most of the MCQs from asbestos and related lung issues you will get of pleural plaques, where you don't need to do anything, and asbestosis. For asbestosis, usually it will tell the person used to work in railway or was a plumber, was working in shipyard few decades ago, was in insulation or construction industry. Now coming in with COPD like symptoms, clubbing, bilateral inspiratory crackles, decreased gas exchange. What is the diagnosis? All the MCQs mostly. What is the diagnosis? Asbestosis. Management, we need to give some long-term oxygen therapy. Investigation wise, we need to do high resolution CT to cover that. So it was basically asbestos and related issues. Three areas from here: pleural and pleural plaques. Chest X-ray is showing something background of asbestos exposure. What you will do? There are pleural plaques, nothing to do. Mesothelioma, palliative chemotherapy. Asbestosis, we know. Working in some industry, coming in with restrictive spirometry, clubbing, bilateral inspiratory crackles, long-term therapy. Here we see, so asbestosis obviously can decrease lung capacity, can cause decreased vital capacity, and can cause decreased gas transfer. The most important thing is restrictive spirometry here along with previous exposure. So this was all about asbestos related things. So we have covered a lot of MCQs here as well. So MCQ showing clubbing affecting lower lobes, slowly progressive. Yeah. So this was basically for asbestosis. MCQ will mention about previous occupation, now clubbing, and restrictive lung function. What is the diagnosis? Asbestosis. So this one is covered. Let's move on to the next topic.